Hello, and welcome to today's panel discussion, the portfolio approach to managing payment integrity. I'm Beth Leibel, Product Marketing Director here at Cotiviti. Thank you so much for joining us today. Before we get started, I want to quickly run through some housekeeping items. We have multiple ways for you to reach out to us during the webinar. Please use the Ask a Question button indicated by the QA logo at the bottom of the screen to submit your questions at any point for our speakers. We'll do our best to answer these questions during the webinar. I encourage you to submit your questions throughout the presentation rather than waiting until the end to ensure that we can get to your question today. You can also use the Email Us button indicated by the envelope at the bottom of the screen to send us an email to request additional follow-up after today's webinar. At the top right, you'll find additional resources, including a link to the Cotiviti Knowledge Bank, which includes links to assets you may find useful, and a link to register for our next payment integrity webinar coming up in just a few weeks. Lastly, please take a moment at any point during today's discussion to answer our quick survey. It's indicated by the clipboard icon at the bottom of your screen. Your feedback is very valuable and will help us determine future topics for our webinars. I'm joined today by Jordan Davinsky, Executive VP of Operations for Payment Integrity at Cotiviti. Jordan's responsible for our corporate strategy and ensuring that this vision aligns with our clients and the broader marketplace. He's committed to advancing our clients' goals through solutions that empower their success in an ever-evolving healthcare landscape. And now let me turn it over to Jordan to kick things off.
Thank you, Beth, and welcome to all of our attendees. It is a pleasure to have you here today as we're kicking off to discuss the portfolio approach to managing complex payment integrity programs. I'm happy to have such a great variety of stakeholders across the payment integrity continuum joining us. I also noticed some SIU and fraud titles here today. Glad to have you. Wanted to mention that we also have another webinar coming up in late September, specifically oriented around fraud, waste, and abuse, called Best Practices in Healthcare Payer FWA. Watch for an email this coming week about that call. We hope to see you there. I have the great pleasure of being joined by an esteemed panel of colleagues today. I'd like to take a moment to introduce them, starting with Mike Jablon. Mike is Vice President of Product Management. In that capacity, his roles build capabilities within the prospective claims accuracy platform. Dr. Christy Ressler is a Senior Medical Director in our Content Department and also a trained general surgeon and colorectal surgeon. She leads a team that is integral to developing our claims accuracy policies and has deep expertise working with our clients across this domain. And lastly, Naomi Murphy, head of our Coordination of Benefits group. She's a tenured member of the team. She has valuable hands-on day-to-day experience working with our clients and our operations and brings a lot of knowledge to the area of evaluating privacy determination. We'll save time at the end for Q&A, but as Beth mentioned, please feel free to send questions in all along the way. As much as this can be a dialogue and not a monologue, we'd love for that to be the case, so please don't hesitate to jump up with your questions. Through our work with our clients, we aim to help smooth the transition from silos to broader solution-wide strategies. And that's the context for today's conversation. Mike, perhaps I can turn to you to kick us off. As the leader in innovating payment integrity solutions for many years, you've seen a lot. Talk to us a bit about how payment integrity has changed in the last 3 to 5 years. Do you feel like we're still battling the same issues? Are things new? What has changed and what stays the same in your view?
Sure. Yeah. Thanks, Jordan. Yeah, I think it's in the past 3 to 5 years has been a lot of change. In particular, the last 2 years, correct? A lot of growth in the market in terms of specialty consolidation with provider offerings, M&A in the market with health plans consolidation or physician practices being bought by large regional systems, and then also COVID planning, obviously, right? And so a lot of the industry adaptation to the pandemic pressures, drove a need for greater automation and operational efficiency as a response. And this wasn't just in large national payers, but also in terms of the smaller market health plan payers, large regional health plans, maybe provider-sponsored plans, all the way down to the ASO level. Everyone became very interested in becoming operationally efficient and creating greater automation to service their members in the market. So, and that's great. That drove a lot of dynamic changes, in the product development roadmaps of both us and our other vendors. But it's also with the rebound, right, the utilization of services that's occurring now. So there's a recalibration of services by the providers themselves to support really accelerated delivery for services that were delayed for the past couple of years. So we've heard from our clients, and we see in the market data that we ingest that the need for expanded coverage in payment integrity in general. And that means a comprehensive view across all claim data, professional, outpatient, inpatient, getting into pharmacy, et cetera. And for those solutions to work, in concert with one another. So same high degree of accuracy is demanded, but at different intervention points within a claims processing system. So whether it's an automated prepayment policy, a validation service that occurs, or a post-payment retrospective. We like to call that a pre, pause, post model. There's been a lot of initiatives centered on that. And with that, as they're looking at policy in the right place to apply it across their organization, they want to make it consistent, right? And then also improve regional parity. So as there's plans that enter new markets, they want to give providers a consistent experience, not only matching area payment integrity rules that may be in place from other health plans in the market, but also making sure they're aligned with Medicaid and state regulations, for example, and particularly with the medical record review area. But traditional areas of care with payment integrity, making sure they have broad coverage, right, and the right coverage in place for their plan. And also in expanding areas of care that we've seen post-pandemic, such as behavioral health, telehealth, and also home health services. So with that expansion, we've seen health plans really pay attention and improve the provider communication. It's been a focus of theirs to be clear on where they're expanding areas of payment integrity, informing providers of changes that are coming up in the payment integrity processing they do perform to try to lower the provider abrasion, right? A population that's had a couple rough years, right? So how do we keep the providers informed when introducing new programs, being agile, to adapt to changing patterns in payment integrity, and then streamlining areas to lower that abrasion, such as one-touch medical record retrieval, and doing a lot of work up front, right? What can we do up front in the prospective review of claims while maintaining and growing the retrospective claim areas as they've always had? So, from a product perspective, we've been pretty hard at work with integrating our data analytics with our clients to support the automated payment integrity rules, but also those human reviews of claims as part of the validation services. And those areas would include COB, right, moving that up front, coding validation rules where a nurse is reviewing opportunity, clinical chart review, looking at DRG claims, and then also SIU, right, where a fraudulent provider is potentially identified. Can we stop that claim and inspect it up front? So that's been a really a big advance and improvement to the client claim flow and data exchange, is that interoperability. So, lastly, our product goal for our clients is developing a best-in-class payment integrity platform. So we want, again, streamlining these differentiated payment integrity solutions, right, so they work in concert with one another. And we're able to accomplish that by working alongside of our clients. So we want to share the goals that we have and our clients have with their differentiated claims platform that they can plug into ours to service. And we look at pressure points, right, in the market, new regulations that have occurred, with COVID and post-COVID, new entrants in the healthcare space that are taking advantage of this innovation in the market and servicing a different population. We look at optimization and consolidation of data feeds. So a client may use, or a health plan in general may use, a lot of different data feeds to support different vendors in different areas. There's much consolidation that can occur that improves a lot of cost savings on their side. And along with that optimization and consolidation of data, it's an opportunity for the health plans to improve. And I think there's little ways to go, but there's a way to improve and review what are their triggers for prior authorization, how are those performing in their market, looking at bypasses that may be in place for certain providers or services. Some of that bypass logic may be quite old, and it's worth a review, particularly with quality measures, to make sure that you're making the right decision on what you're choosing to bypass, what you're choosing to move through payment integrity. And again,
yeah. You might not ask you a question, because you touched on COVID and our reemergence from the thick of COVID and beginning to move through a backlog of cases that had been postponed. And oftentimes in healthcare, we talk about the fierce urgency of now in addressing the immediacy of the issues at hand, while also trying to keep one eye towards the future. And I'm curious, when you talk to our clients today, how urgent are the discussions with payment integrity leaders? What are you hearing in their voice? What appear to be their top concerns as we come out of COVID?
Yeah, so I think that their top concerns, again, are the completeness of data and being able to swiftly apply changing rule behavior to the environment, right? So if for instance, during COVID, we had different bypass rules that came in place to bypass vaccine logic. How quickly can these bypasses get into particularly in a high volume situation? How quickly can those rule changes be put into a claim integrity environment? And then how is the data analysis, right? How are they, great. We've bypassed a code, but how is it performing, both in terms of response to the providers, but also quality? Is it being taken advantage of by bundling other services with that? And then what's an efficient way to communicate those changes and also take them out of the equation when the time comes?
Makes sense. So related question for you. Obviously, a good bit of what we do here at Cotiviti is related to payment integrity. And we're certainly not the only vendor in the world that does this type of work. And I'd love to ask you a question that's agnostic of be it Cotiviti or anyone else. We certainly are seeing a lot of our clients engage more partners because payment integrity has gotten increasingly complex. In your experience, what are you finding to be best practice for working with partners to ultimately achieve success in payment integrity work?
Sure. Yeah. It's a little cliche, but teamwork, is the number one, right? So to your point, there are a lot of different payment integrity vendors in the market providing expertise in different services. Sometimes they overlap and you have a point of comparison. Sometimes they're differentiated, but they need to integrate. So teamwork is the best practice we see, in our clients and what we see in the market, just in terms of setting a shared vision in an organizational priority, right? So if you're working with a vendor on payment integrity, focus on where you want to be and engage with your business partner, which is the external vendor, but also your internal partners, right? The supporting departments at the outset, right? From sales, into the implementation, into operation. It really helps plans to define what payment integrity means for their organization and the value that it serves, how it reduces improper payments, right, which is a goal, how it advances that efficiency we talked about at the beginning, both in operations, but also within your provider network and also within your customer experience. So, spend time reviewing the findings that your payment integrity partner brings to you and review with claims data, with examples, and decide where that partner can make an impact, right? So know where your payment integrity strengths are and where you need that support. Where do you need to augment your staffing and services with a vendor after you validated that data? So, I can't stress enough having engagement early in the technology review of how a API vendor will interact with your systems and potential other vendors in your PI stack is really important. So understanding your systems, mitigating risks, discussing the implementation approach and the timeline. And I recommend, standing up a steering committee as well, right? So a team that can quickly get questions answered by to your vendor, mitigate or solve any issues that might crop up with data exchange, and build a team around that effort. And make sure that team has some energy and enthusiasm about the initiative, right? Get them involved early, keep them informed. That'll keep your team engaged, so they not only have a good understanding of payment integrity, where you want to go, but where it'll go in the future as well. So we find that's very important. I think one last question.
Sure. One of the things that crops up in your commentary is obviously this notion of teamwork, but also getting aces in their places. This notion of right skills, right place, right time to have the most impact. And it certainly makes me think about, once a partnership has been consummated, shifting the conversation towards some of those more technical pieces of implementing a PI program, thinking about policy selection, thinking about adoption. And Dr. Ressler, I'd love to probe that question a bit with you, thinking about your experience, both on the content side and the client side. Can you share a bit of your experience about how silos in that continuum may affect policy selection or policy adoption?
Sure, absolutely. I'd love to. Well, the first thing I want to say is I echo what Mike says about having an engaged and energetic team, because when it comes to content selection, we definitely need that, because it can be a very laborious process, and we need people who are invested and very interested in our content to be able to get through all of it to go through an implementation. But I do have to say that within Cotiviti, we're quite fortunate to have very large and very active content teams, both in the prepay space as well as that post-pay space, who are solely dedicated to the creation of policy for our clients. Now, admittedly, and with a little bit of hindsight, we've noticed that the communication between those two content teams has not necessarily been robust. So, there are some silos that exist within policy creation, which, we really weren't even aware of until we took a close look at it. And now that we know that it exists and that it is, a true thing here within our own organization, we've been working really hard towards breaking down those silos, our own internal silos. And by doing that, we've really changed the outlook on how we're going to be building policy and how we've been building policy moving forward. So through our own internal collaboration, we've really been seeing that there's this great overlap of concepts between what our clients are doing in the prepay space as well as the post-pay space. And we're currently working to optimize the selection that our clients have, with the ideal future state being one where we have all of our concepts within any location in the payment integrity lifecycle. So what this means for our clients is that they also have to break down their internal silos, or at least start that process of identifying that they're there. Like I said, we didn't realize ours were here. And once we started taking a dedicated look at it, we noticed that it did exist. And so if we can have our clients break down those internal silos and have these types of communication across their payment integrity space, then, that will be beneficial for everyone moving forward. And, we do have some clients where we've seen this type of collaboration between the prepay and the postpay departments. And we've actually seen it work very smoothly in terms of, concept or policy selection. So over the years, I'm a prepay person. That's the space that I work in. And over the years of doing a number of our new client implementations, it's interesting because we've often had our clients ask us to turn on certain bypasses, like Mike was alluding to. This could be something like bypassing a line of business. Maybe they don't want to apply some of the editing capabilities to the ASO line of business, or maybe more of like a generalized concept that they don't want to apply editing to gender or to maximum units. But what we've found with some of our clients who have both the prepay and the postpay in place is that those concepts that are being bypassed in prepay seem to be fair game in the postpay space. So we often wonder why that is. Is it a conscious decision within the health plan to do it that way? Does the prepay team know that these concepts are being edited in the postpay space? And if they did know it, would that change their mind for creating those bypasses in the prepay space in the first place? And could it potentially widen or broaden the amount of concept or logic that they could really take if they knew that that was occurring? So on the other hand, we also know that there is some hesitancy in having the same or similar concepts crossing both the pre and post-pay space. However, our suggestion would be really to have them exist in both of those spaces. And just because a concept is turned on the prepay side, it doesn't necessarily mean it's going to edit. There may have been another concept that had a higher priority that created a different edit. And so that other concept will essentially be left untouched in the prepay space. And so then it can move to the postpay space where those savings can then be captured. And similarly, we also understand that there might be some hesitation in moving certain postpay concepts to the prepay space. Since certain concepts like clinical chart validation have traditionally been reliant on that human review of a medical record. But our content team on the prepay side has been very conscientious about this as we've been working to develop new policies in our prepay space that are based on those post-pay concepts like DRG review. Since we have our coding validation platform, which is essentially a pause and review platform, this provides human insight and review prior to making that final determination. So it's been a really good way to more fully utilize the functionality of that platform. And I mean, finally, we know there are a lot of decisions to be made during a policy review or a concept review session in terms of where a concept should live or how it should edit, meaning automated versus the pause and review versus the post-pay and chart review. And we're always happy to provide the support and expertise needed to make the decision that fits best for each health plan we work with.
One of the things you mentioned I'd love to pick back up on was the work that you and your team have been doing to consolidate the content library, thinking across the pre and post domains, as well as some of those concepts that perhaps have been slightly differently applied over the years. And I'm curious, in your experience, as you've gone through this effort of bringing together what have historically been slightly more disparate concepts, have you bumped up against any big surprises?
I wouldn't necessarily say surprises. I think the thing that we've found the most interesting in the whole process is that maybe in the post-pay space, the logic is considered in one light or in one particular fashion or way. And in the other space, it's kind of thought of a little bit differently or maybe even labeled differently, right? So they have two different labels. But when you really look at the heart of that policy, you see that it comes from the exact same reference, say, or same source. And so that just really speaks to the different way that policy can be approached in the prepay space and the post-pay space. So it may all be the same logic, the same concept, but we can come at it at different angles depending on which platform we're looking at using. And that's why those things tend to be very complementary to each other.
Great insight. Thank you for that. By the way, I'd love to remind our attendees, please feel free to dive into the chat, send us questions, and we'll be happy to pick up on those as we go through today's conversation. Following up on Dr. Ressler's points about the benefits of moving certain things from the post-pay domain to the prepay domain, certainly if this is done thoughtfully and carefully, it can have a huge benefit to plans. And one area where we've seen this has been in coordination of benefits. So, Naomi, perhaps I could turn to you and garner some of your reflections on what you've seen and some of your experiences related to that shift from post to pre.
Absolutely. Thank you, Jordan. As many of you know, COB presents a very unique opportunity to intervene early in the payment integrity space. We know health plans are actively looking for ways to both identify other insurance for their members and also determine the correct order of benefits as early as possible, of course, without unnecessarily burdening providers or members. But before we talk a little bit more about the value of a prospective COB solution, let's take a minute first to level set on terminology. The phrase prospective coordination of benefits, or PCOB for short, of course, is used to broadly describe really any asset or solution that is used to assess the order of benefits for a member before a claim is actually paid. But in practice, what we've learned is that there can be multiple intervention mechanisms before that claim is paid, or even really received for that matter. In addition to that, we've also learned that there is a significant difference between a data asset, for example, like the CMS Section 111 file, and a full-scale coordination of benefits review, which would be similar to what Cotiviti offers by way of a pause and pay PCOB solution. For purposes of our conversation today, let's keep it simple and orient around prepayment and postpayment as the primary intervention points. We know from experience that a single COB solution with multiple intervention points creates really three primary value streams for health plans. So let's take a minute now and just review those quickly. The first is improved value capture. And what I mean by that is what we're seeing is that the health plans are getting more from each dollar identified as an overpayment. we know that there are quite a few complexities in recovering dollars from providers. By stopping the payment before it goes out, of course, the health plan is typically able to get the full value of the savings, rather than some mitigated percentage because a provider or a member got involved in the process. Simply put, instead of 60 to 70 cents on the dollar on average, the plan has the opportunity to collect the full dollar, or something very close to it. The second stream of value that we've seen is, of course, increased cost avoidance. Now, COB will always offer some degree of cost avoidance, even in the post-payment space. But as you would suspect, the earlier or the sooner you identify the correct order of benefits, the greater the cost avoidance will be for any given member. Early intervention always equals more savings. And lastly, but equally important, the last value stream that we've noticed is that our health plans benefit from lesser taxation on their internal resources. And probably more importantly, the ability to optimize the use of that incredible talent. We know that health plans are tasked with more than payment integrity. And what we've seen and what we've learned from our clients is that they are able to skillfully reallocate talent to other important tasks when they are not required to chase down a recovery or deal with any of the post-payment recovery. So we know the business case for PCOB is compelling. And to Dr. Ressler's point, there's real value in bringing things forward. But one thing that's very important to remember for COB is that while all COB concepts can in fact be moved upstream, not all COB content can be moved prepayment. In our experience, between 25 to 35% of the COB findings can in fact be captured before a claim is paid. Now you may be wondering, well, why is that the case? The primary reason that some content cannot be moved prepayment, and this is particularly true on our more complex cases, is because those analyses require a much more thorough and at times lengthy endeavor. So for example, we may have to collect information from an employer or other external sources. And that can't always be obtained, that information, within a defined PCOB SLA. So now that we've covered the basics on PCOB, I think it would be helpful to just share an example of a recent resounding win that one of our clients had at the PCOB space. The Cotiviti team identified a $512,000 single claim. It was grounded in commercial other health insurance for one of our clients. The claim was paid to a provider, or would have been paid to a provider, that was off limits for purposes of a retrospective review. But because the health plan was able to prevent the claim from actually being paid, it avoided the entire cost. Now, had the claim been paid and subject to a retrospective review, of course, as I've explained, due to the contractual provider restriction, those cost savings would have been lost to the provider. So this was a great win and a great example of why it is critical and really beneficial to employ a PCOB program. One additional note.
If I can interrupt, only because a question came in that I think speaks directly to the commentary you were just giving. As one of our attendees is asking, how does Cotiviti calculate and show the value capture from prepaid COB solutions? Can you share a little bit more about how we think about that calculation? It's relatively self-apparent in the post-pay space. How do we do that in the prepay space?
That is an excellent question. So thank you for that. The primary ways that you measure the output or the result from implementation of a PCOB program, there's going to be a couple of ways to do it. The first, of course, is actual cost avoidance. So we can actually measure how much the plan would have paid in the 12 months following the finding, to say, how much were you able to successfully cost avoid as a result of early intervention? Now, of course, there's going to be obvious examples like the one I just provided where there's a direct correlation because you could not have recouped or recovered those dollars in the post-pay space due to any number of issues, including a contractual restriction in an agreement with the provider. So one of the primary streams is always going to be, what cost did you avoid? Another way to measure it is to really compare your recovery rate or your savings rate in the post-pay space to that in the prepayment space. And again, what we've seen is that the difference is marked. For example, if in the post-pay space, you're averaging 60 to 70% of the recoveries based on the identified overpayments, we've seen those as numbers as high as 95 to 99%, meaning, again, you're getting more value for each dollar that's been identified, therefore increasing your savings. So that's another way that you can measure the utility or the output from a PCOB program.
Thank you for that. Great explanation, and likely a question that is going to continue to be very top of mind for health plans as more and more of the value shifts from that post-pay space to the prepaid space. One of the other themes that you mentioned was the concept of edit sequencing. How we think about what happens when and the value of certain activities occurring either before or after other activities. And Naomi, I don't know if you wanted to comment on that, or perhaps Mike, you have some thoughts to share, because it strikes me that this notion of edit sequencing is not something that we've historically talked a lot about, and yet its value will become more and more pronounced as we move forward.
Yeah, I think I will turn this over to Mike in short order, but one thing I will note is that one of our learnings in the PCOB space is that really to effectively implement a prepayment COB program, the sequencing of edits is critical to the program's success. And this is particularly true given the complexity of many health plans' payment integrity landscapes. So it is a very germane part of that process. And Mike, I would turn it over to you for some insights that you may have on this topic.
Sure, yeah, thank you. Yeah, I would say, Jordan, Dr. Ressler and Naomi and I and others, our colleagues, we probably talk about this subject every day, hours a day, not only hypothetically where new products should be placed in the payment continuum, but also looking at the real world results. Are we making the right decisions in terms of payment policy application? So it's an interesting challenge, right? The data and trends behind data integrity and where you place different intervention points in a stack or an order is fascinating for people that involved like working with data. But it informs our recommendations to the health plan clients. So as Naomi mentioned, we're working in conjunction with or in collaboration with other vendors in the space. Usually a health plan's own payment integrity efforts, but having that consistency, right? A consistency of run order, consistency of defensibility and coverage is really paramount to a well-architected payment integrity program. So, working with our experience has been working with our clients and our implementation teams working with clients. They help determine the best order of implementation for a client. Every client is unique. Every client is a little different. But you want to provide some standardization and commonality for your providers out downstream or your members downstream. So we work with them on the order of operations, making sure it's clear, and transparent, particularly in a multi-subscribed vendor environment that we could be working with. So to Naomi's point, like COB as an example, it makes sense to run that up front, right? Is this even your claim, right? If there are indicators that say this should be stopped and not even go through your payment platform, you should stop it as early as possible where you can. Other areas that we use for consideration of payment order, is looking at local or national recognized guidelines, right? And building that into your plan, particularly if you have a Medicaid component to your health plan. So expert reviewers to analyze the data with data mining, with medical record review, what can be automated, what is a validation service, and then what validation service wins in terms of code review, nurse review, audit review, SIU review, et cetera. All that is taken into an account to make a customized order of edit of operations for the payment integrity programs.
And a related question to put to any of the members of our panel relates to product development. And certainly I've heard from some members of the broader healthcare community that payment integrity is mature, there's not much more value to be had, and the implicit implication, if not explicit, is there's not much more investment to be made that's going to yield substantial return in payment integrity. And I'd be curious your experience and beliefs about product development, product innovation related to payment integrity. Do you believe there's a lot more run room still ahead of us? Are there any specific areas that you get particularly excited about? So I don't know if any of you would like to comment on that. I'd certainly be curious to hear your views, and I'm sure our attendees would be very curious to understand how we're thinking about whether or not there's much more there. Any thoughts on that?
Yeah, I'm happy to take that. I think, I've been working with payment integrity with Cotiviti for over 15 years now. And I'm constantly amazed at, what's new in the market, what's new from a regulatory complex, what are new products and services we need to offer to expand the growth of payment integrity in the market. I think you could look at large national health plans in terms of, is everyone utilizing a vendor, and does everyone have a payment integrity offering? Yes. Is there opportunity to expand that again to the smaller regional plans, work-in employer solutions? There's a lot of opportunity for growth there. I think going back to how we started the conversation with COVID, that's really changed the market in terms of what's going to be developed in the future. We're seeing populations move out of cities, into rural areas, moving to smaller communities for quality of life, and they have the luxury of a remote work atmosphere, right? And so those communities that were surprised by this growth, right, this uptick in growth, they need to provide quality healthcare and services. And so with that, the dynamics of how care is being delivered is changing, right? Whether it's going to be telehealth, virtual services being expanded, and new rules being created to manage that. And then not only the virtual services, but also a rejuvenation of like brick and mortar facilities within rural areas, or expansion, right, of major medical centers in the rural areas. And then also, large national plans. So the trust in care, they used to say all healthcare was local. I think that's changing, right? So it's changing generationally, right? So we've got a diverse member set who trust data more. They were born, with data. They have a phone in their pocket. And so being able to look at a local care provider, for some services, or a distance center of excellence, as long as it's within their network, or accessing a national vendor who's striping across services. I think there'll be a lot of interesting partnerships and innovation in that space that'll result in new and different ways of payment integrity and utilization in the future.
Thank you for that. And Dr. Ressler, Naomi, anything you would add to that as you think about innovation?
Yeah, I mean, from my perspective, I'm content focused, and I'm excited every day, honestly. I feel like there is no end to what it is that we can develop and to what we can create. And, if it's a matter of taking things that already exist and repurposing them and trying to figure out a different way to use that, or just absorbing all of the changes, as Mike was saying, that are coming down the pike, changes with legislation, changes with, guidelines. It's just an ever-changing world. And, honestly, I'm doing the best I can to keep up with all those changes. So in my opinion, from a content perspective, there's lots more to come, and very excited about pursuing all of the new adventures as well.
Excellent.
I would echo my colleagues' sentiments there. I think one of the most important things in the payment integrity space is to evolve. And certainly evolution, of course, is the enemy of stagnancy. And I think one of the most important things that we can do as part of a collective industry is to continue to evolve and to improve and to listen to the market. We know, particularly in COB, you're dealing at your very core with members, and people certainly don't stand still in life. And they get married and divorced and have kids and change jobs. So there's a constant sort of pulse of movement. And I think the most important thing as we continue to improve and create new capability is to always align to that in the most fundamental way that we can. So I agree.
Very well said. Mike, since we began the conversation with you, perhaps as we come upon the 45-minute mark, we can wrap up this part with you, and then we'll turn to questions. Anything that you want to leave our listeners with today, important takeaways from this conversation, and any reflections that you believe they should take with them as they're focusing on their own payment integrity programs?
Yeah, sure. I think you've heard, I think we've all explained it, the market is always changing. It has changed, it's changing now, it's going to change in the future. Having all the components of a payment integrity plan in place is important, to meet these demands, shifts, and challenges. Get prepared, right? Don't wait for a problem to ensue and then have to go fix it. Get informed, be ahead of the game, anticipate where the market's heading. I'd say, another takeaway is, everybody's busy, right? There's lots of projects and involvement, particularly within your IT department and testing departments, that you will rely heavily on as you're working with a payment integrity vendor. Make sure you involve those departments early and often. We've talked about getting people, enthused and excited so they understand what you're trying to do. It's not just a piece of software. It's a payment integrity is a vital, business component that shows our ROI to an organization and to an IT organization who's looking for ROI within their projects. So make sure you have those right people involved at the outset. And then you've heard about a multi-vendor, multi-product environment as well. I mean, this includes your own internal teams. Everyone has a payment integrity department in place today to varying degrees of capacity. It can be fatiguing for that group of people to work with different vendors, to work with different services that have different names, that don't work in concert with one another. So make sure you plan out and you space new payment integrity offerings with your internal teams and line them up in the right way for efficiency and deployment, understanding it within the department, and then enablement in production. And make sure you communicate to those providers in production as well. Again, we talked about that trend where provider communication is very important. Don't underclub that. Keep everybody informed, both internally and externally.
Really important points. I appreciate you raising the topic of communication also, Mike. It's certainly one that is easy to overlook, but one overlooks it at their own peril. So glad you hit on that just now. Would love to open this conversation up to questions from our audience, so please feel free to send those in through the chat. Picking up on the first question here, and Dr. Ressler, perhaps I can turn to you. Can you give an example of why the content team might build a policy as either an automated edit or a pause and review edit, or both?
Well, sure. I think for the most part, when we think about automated edits and what's typically well suited for that, it's logic that's very black and white, and which is typically referenced to national guidelines. So if there's a guideline out there that states, code X should not be billed with code Z, then that's pretty easy to build, and it's pretty easy to justify that being an automated denial. But in situations where there may be more of a gray zone or an area of interpretation, like maybe a governing body or CMS only publishes, a partial diagnosis list, and then we have to use our interpretive skills to really make it a full concept, that might be a good place and a good idea to have a pause and review, where this will give the claim reviewer the opportunity to look at the claim history, get a better contextual picture of what's going on with that patient, and make a more informed decision in terms of whether that denial should stay or whether it should go. The other idea that we have in terms of why we'd want to in both an automated and a pause and review space would be something like a logic like duplicates. There's very defined criteria that we can look at and be very, very selective in terms of how we define something that's exactly the same as the other. For an automated perspective, we would want to be as precise as we possibly can because we know there's not going to be any review of that. And so when you do it that way, you think that logically, it makes sense that you're narrowing down your claims universe of what's actually going to be able to edit. we take a step back from that and we think, you know what, let's just remove some of that very specific criteria. Let's broaden our net. Let's see what else we might be able to get to pull in that could potentially still be a duplicate, but maybe not have that much of exact matching logic. So once we do that and we have a wider net to throw, we want to bring in that human touch, like I mentioned, so that they can take a look at that claim history and get that contextual data and then make an informed decision. So that's where we could have a similar logic, both as an automated concept as well as a pause and review concept.
Thank you for that, Dr. Ressler. Our second question here, this looks like a question probably best addressed by Naomi. It reads, I've worked in payment integrity for 25 years, and for that long it seems we've been talking about automation, but this is still a people business. Where do you see the future of automation and other technologies for payment integrity?
I would say it's a beautiful marriage. And the reason I say that is because automation obviously has great benefits and offers a pacing and precision that is both desired and also really quite welcomed when it's integrated into a robust program. The reason that I think it needs to be coupled oftentimes, potentially at least in the COB space with some element of a review, it really comes down to accuracy. So when you're thinking about entitlement and members, one of the things we insist on doing as part of a robust validation process is ensuring that we have the most accurate, most recent entitlement information, whether that needs to be derived from CMS or from another commercial payer. And the submission back to the client with those findings needs to have a contemporaneous validation of that information. So again, I think it's about finding the right blend of automation and validation and expertise. And I think when you can nail that, that's when you get the maximum benefit of both the automation and the talent, and of course, the value delivery back to the health plan.
Great point. And thank you for sharing your expertise in that regard. Next question is about payment integrity and value-based care. And this is an interesting one. It tracks with some of the conversations we've been having here at Cotiviti. Someone's saying, our executive team continues to fret about payment integrity in a value-based care world. Does Cotiviti have a point of view about how payment integrity will change with the uptake of VBC? Mike, do you have any thoughts on this one, value-based care and payment integrity? What's the impact to PI?
Sure, yeah. So value-based care has been, within our product roadmap, on our radar for the past, 10 years now, in terms of payment integrity and how it's utilized. I think in the past, there were a lot of different definitions of what value-based care meant, whether it's to an organization or a health plan. They're all a little bit different. And we're starting to see now some commonality and some guidelines coming down. I think some initial forays into looking at value-based care and provider scoring, into PI is what we talked about earlier in terms of health plans using that data to inform where they're choosing to make certain bypasses on in terms of either procedures or individual providers, and looking at, are they making the right choices, and using that information from quality, not only to inform network and payments, but from a PI perspective to make sure that they're, could they be gold carding, providers that don't need to be gold carded? Do they need to take another look at a service line that has excess spend, and is there opportunity there? That additional data that kind of decorates, the claims environment that we work with typically, it really informs the decision making and helps, Dr. Ressler and the client teams customize logic and policy for an individual client so it meets their goals and needs with value-based care.
Great. And our last question here, does Cotiviti provide reporting on policy and edit categories that shows the value captured from these policies and edits? Dr. Ressler, perhaps you can weigh in on this one.
Sure, absolutely. The short answer is yes, we do provide that. Just to expand a little bit on that answer, when a health plan partners with Cotiviti, they are assigned a client team. And within that client team, there's a number of different people. Some have, business more of the control the business parts of the relationship, and then we have policy owners, and you have a client medical director, and between all those sets of people, that reporting is produced so that the health plan can see, the benefits of the policy that they've chosen and the value.
Thank you for that. And thank you to all of our amazing panelists and for all of our attendees who've joined us today. I know getting an hour out of the day is hard to do, and appreciate your willingness to engage with us on what we believe is an incredibly important topic in today's healthcare environment. With that in mind, Beth, I'd love to turn back to you. I believe you have some housekeeping items to address before we formally close today's call.
Thank you so much, Jordan and Naomi, Mike, and Dr. Ressler. That was great. And to our audience for those awesome questions at the end. We love an interactive discussion. This concludes our webinar today. We will be reaching out to you via email shortly. We'll have a link to the on-demand recording of this webinar. And please don't forget to take a moment and answer our short survey about your experience today. Finally, please be sure to register to for our next payment integrity webinar called Managing a Connected Claim Continuum, and that's going to be held on September 15th. You'll get an email about that, and you can also find a link in the resources box at the top right of your screen right now. Thanks again for joining us today. We really look forward to seeing you again soon.